Hi there, my name is Brenda Berry. I am a health coach and I took care of my nutrition and my mindset starting a couple of years ago, lost a bunch of weight and I feel pretty amazing. And I was curious about supplements, started looking into it and found an incredible company and an incredible man in Dr. Nolan White, who has been helping me navigate this. Hi, Dr. White, how you doing?
Hey, good.
Well, I think I've been talking to some people, as you know, about my own health journey and how I can maybe help others in theirs. And my own question, and another one that I come across is, although I think I've kind of figured it out for myself, but if you, other than not feeling well and having a specific issue you want to address, how do you even know if you need supplements, much less which ones? For example, I don't feel bad. I don't have any issues to speak of on a regular basis. I did start taking collagen and I've had some results with that I wasn't expecting. I do a little bit for, some natural energy, but what else do I need and how would I know? That's kind of what I want to know from you is in general. I know you can't say everyone needs the same thing, but in general, what do you think about how do we determine if and what we even need as far as supplements go?
Okay. Well, thank you. Yeah, my name is Dr. Nolan White. I'm a chiropractic physician practicing in northern Utah and been in practice for 34 years. And I enjoy learning and trying to find things that help my patients better as well as with my family. And a lot of the answers to your questions has really kind of come from observation for me working on my patients. Now I do muscle testing, kinesiology testing in my practice. So I'm able to discern from my patients really what their body is lacking and what their body is needing. And you in your question, you kind of mentioned a couple different things that was really interesting. You mentioned before about you working on your mindset, right? Personally.
Yeah.
And I think that's very, very important when you're talking about health, because what we think is very, very powerful. Our body is very obedient to our perceptions of stress, so to speak. If I have a stressful approach to my body, if I'm thinking about disease, if I'm thinking about worrying about disease over health, then my body is in a fear mode. Thinking about disease. Well, fear is a negative energy, negative vibration to the body. And we're going to have a tendency to create the very thing that we're fearing if we're worried about disease versus thinking about health. Health is a positive thought process. So what's interesting is I think we need to keep our mindset proper in order to have good health. So I love it, the fact that you are doing that in your personal life. As well as there's nutrients that are helpful with that. One of the products that that I believe in is called Brain Sense. And one of the biggest reasons I believe in that wholeheartedly is because that helps us with our mindset. If we can provide the nutrients for our brain, it's easier to have a better mindset. If our brain is lacking nutrients, it's going to be harder. We're going to be stuck in more of a fear mode or a negative mode. And so that's why I'm really partial to that product when we're thinking about our overall health, because I think it all begins with our mindset and our thoughts. So it's probably got off the path a little bit on that, but some of the symptoms, I guess, someone would think of with how do I know if I need supplements or whatever, is I would think of digestion. How am I having a bowel movement every day? At least one bowel movement every day. If I'm not having a bowel movement every day, then we got something going on, because by the time the stuff reaches our large intestine, the body goes, I don't want this anymore. And if it can't come out, then those toxins are going to recirculate through our body. So having regular bowel movements is very, very important. So that can be dealing with digestion from the stomach or the small intestine or the large intestine. So that's something to consider. Overall energy. How's my overall energy? If I'm dragging, then I may be lacking something. That many times it's B vitamins, maybe it's support for the adrenal glands. That goes back to probably the brain support from my standpoint, because if we can provide those nutrients for the brain, we're going to have more of a positive spin on outlook on our body and our in life, and that's going to by itself create a little bit more positive energy for us. How are we sleeping? If I'm not sleeping very good, if I'm waking up very tired, or if I'm having a hard time going to sleep, or if I wake up many times during the night, sleeping is when the body heals. So if we're not sleeping well, then there's some type of imbalance we need to address. So those are probably some very, very basic factors that I'd be looking at. And I would probably, I kind of have a tendency to think back once again with that brain sense formula, because it is a multivitamin, but it's more than a multivitamin, but there's nutrients in there, broad enough nutrients in there to cover a lot of different things. So personally, if I could only have one supplement, that's what it would be, just because of the balance of nutrients and minerals in there, and its systemic effect on the whole body. That's what I choose. Now, one product that I do a lot of different seminars, I do a lot of cold laser therapy in my office. When I attend a lot of those seminars, they talk a lot about the good fats and the omega-3 fats. The most Americans really lack omega-3 essential fatty acids. We get a lot of omega-6 in the not so good fats. So getting some good fish oil is really probably a need, that a good omega-3 is probably a big need we have in our American diet. So probably those two things, the brain sense formula from Common Sense that we talk about many times, as well as getting a good omega-3 fatty acid, because the normal diet which we eat does not have as many the good fats in it. So that's going to affect the brain. It's going to affect inflammation throughout the body, and the transmission of nerve flow as well. We need good fats in order for our nerves to fire efficiently. So those two things would be probably my biggest recommendations. There are different products we talked about before with sleep. Many times balancing the brain will help sleep, but there's Common Sense has a product called, let's see if I don't need, unless you have it there.
The Sleep Sense.
Sleep Sense.
Yeah, I have used this a couple of times. I'll tell you, I don't need a lot of help sleeping. So I did this as a little tester, a half, and it helped me sleep. I didn't want to keep doing, I don't need it. So I didn't, but it really worked well. And I've sent this supplements or samples to some people, and it's really helped a lot of people already. This is a really nice, a nice product for sure. And it's interesting what you say too, because, I've been talking to people for a couple of years about their health, and you think weight loss is always going to be the first thing, and it's not. It's sleep, it's mindset, it's, confidence, it's feeling like they're in control, it's getting their minds to stop racing. It's, all of that comes down to maybe losing some weight, and that might be a result of what you do. Right. But it's all these other things that people don't think of. And, daily going to the bathroom every day. You'd be, well, you wouldn't be, but people are surprised when I say I have clients that I've talked to that they go once a week, and they're surprised that you're supposed to go every day. So, it's things like that are maybe those clues that people don't understand, or even clues, but they're big, huge clues, Yeah.
And I would say probably even with the energy, sometimes it could be as simple as drinking more water as well. If the sluggishness, once again, the body has all these different functions. And if you're thinking about it, once again, from trying to remove toxins from the body's always trying to figure out ways to be efficient in removing toxins from the body. If we don't have enough water, then those toxins aren't going to be able to be as efficiently as removed from the body. And that can create fatigue and, energy and aches and pains and inflammation. So very, very basic thing. But if we increase our water,
And that water just
and-
helps get that stuff out of there. Like you said, it's just, it's the way it's supposed to be. It's kind of icky stuff, but that's why you get rid of it, right? You're not getting rid of the stuff your body doesn't need. It just builds up in like a cesspool, right? And then there's all this icky stuff just getting into your system where the good stuff can't get in. And then you're passing, if anything, you pass the good stuff, and the bad stuff is just seeping in and making you sicker, right?
Absolutely.
And people don't realize, and gut health is kind of a trendy phrase these days, but it's not even just gut, it's just taking care of your body properly so you can do its job, right?
Right.
So, anyway, well, thank you. And I would agree that it all starts with mindset, right? And the brain sense has helped me, my husband, and even my teens. We're all taking this, and it's just really been an impactful change in our family. And for me, I also have ADD, and it's really kind of taken another edge off of my brain and the way it's been. So I'm really, really grateful for this. I'm not someone that likes to take a lot of stuff. I'm a little gun shy when it comes to, I know it's just a supplement, but it just makes me a little, I don't know, it's just awkward for me because I've never taken anything. I've never taken anything regular in my life, ever. So it's just a supplement. I'm not worried about it, but it's just new. So I think for a lot of people, there are people out there that have taken supplements their whole life and have taken every which one and switch them off all the time. And there are people like me that don't have a clue. So that's why I wanted to talk to you today, because I think this will be really helpful just to give some general guidelines about kind of what to look for and how supplements even work and what they are. And we're going to start to kind of just educate people a little bit more. And that's why we're here, right? Is to educate and pass on this information, because this seems a little selfish not to, when you have a way to help other people. So thank you so much for your time and all your input. And I just really, really, really do appreciate your time in helping me and the people around me get healthy in any which way we can. And if you are watching this on my YouTube channel right now, please like and subscribe. We're going to come out the rest of this year with a lot of regular, consistent information on how to get you and your family healthy. So from me and Dr. Nolan White, thank you. And thanks for being here, doctor. And we'll see you next time. Bye.
Okay. Bye.
Glasses.